Welcome. Today we're diving into a rare and fascinating neurological disorder called neuromyotonia, also known as Isaac's syndrome. Join us as we explore its causes, symptoms, diagnosis, treatment, and more. Let's unravel the complexities of this condition and understand how it impacts those affected. The exact cause of neuromyotonia remains a puzzle in many cases. Often it's considered idiopathic, meaning the origin is unknown. However, in some individuals, it's linked to autoimmune disorders, where the body's immune system mistakenly attacks its own nerve cells. Certain cancers, particularly thymoma, and exposure to specific toxins have also been associated with the development of this condition. Genetic factors are suspected to play a role in rare instances, pointing to a complex interplay of potential triggers. To understand neuromyotonia, we need to delve into its pathophysiology. At the heart of the matter lies the hyperexcitability of peripheral nerve axons, specifically at the neuromuscular junction. This abnormal activity stems from disrupted voltage, gated potassium channels, which play a crucial role in regulating nerve impulses. When these channels malfunction, nerve fibers spontaneously fire, leading to continuous muscle fiber activity, even at rest. Think of it like a short circuit in the body's electrical wiring, causing muscles to constantly twitch and contract. Neuromyotonia is a very rare condition. Accurate prevalence data is difficult to obtain due to its rarity and potential for misdiagnosis. However, estimates suggest that it affects a very small number of individuals worldwide. It can occur at any age but is often diagnosed in adulthood. Both men and women are equally susceptible to developing the disorder. The hallmark of neuromyotonia is continuous muscle fiber activity, leading to a range of distinctive signs and symptoms. Patients often experience muscle stiffness, cramping, and twitching, even at rest. This involuntary muscle activity can affect various parts of the body, including the limbs, face, and trunk. Other common symptoms include delayed muscle relaxation after contraction, increased sweating, and difficulty with speech or swallowing. The severity of symptoms can vary widely among individuals, impacting their daily lives in different ways. Diagnosing neuromyotonia involves a combination of clinical evaluation and specialized testing. A thorough neurological examination helps assess muscle activity and reflexes. Electromyography, or EMG, is a crucial diagnostic tool. EMG records the electrical activity of muscles and can reveal the characteristic patterns of continuous muscle fiber activity seen in neuromyotonia. Blood tests may be performed to look for antibodies associated with autoimmune disorders or other underlying conditions. In some cases, nerve biopsies may be considered to further evaluate nerve function and structure. While neuromyotonia can be broadly classified based on its etiology idiopathic, autoimmune, paraneoplastic, there aren't distinct subtypes with significantly different clinical presentations. However, the presence or absence of associated autoimmune disorders or cancer can influence the overall management approach. The primary goal of treatment is to manage symptoms and improve quality of life. Medications, such as anti-epileptic drugs like carbamazepine or phenytoin, are often used to reduce nerve excitability and muscle activity. Immunosuppressant medications, such as corticosteroids or intravenous immunoglobulin Iviga, may be prescribed to address underlying autoimmune processes. Plasmapheresis, a procedure to filter antibodies from the blood, can be beneficial in some cases. Physical therapy can help maintain muscle strength and flexibility. In severe cases, surgery may be considered to remove a thymoma if present. Unfortunately, there is no known way to directly prevent neuromyotonia, especially in cases where the cause is unknown. However, minimizing exposure to known toxins and promptly addressing underlying medical conditions, such as autoimmune disorders or cancer, may help reduce the risk in susceptible individuals. The prognosis for individuals with neuromyotonia varies depending on the underlying cause and the severity of symptoms. In some cases, symptoms can be effectively managed with medication and therapy, allowing individuals to maintain a relatively normal lifestyle. However, in other cases, symptoms may be more persistent and challenging to control. Recent research has focused on identifying specific antibodies associated with neuromyotonia and developing targeted therapies to address the underlying autoimmune mechanisms. Further studies are needed to better understand the disease and develop more effective treatments. Ongoing research provides hope for improved outcomes and a better quality of life for those living with neuromyotonia.